For many years, physicians have treated glaucoma with invasive surgery and medications. However, it can also be treated with laser, a minimally invasive and non-incisional procedure.
Compared to either eye drop therapy or surgical treatments for glaucoma, laser has several advantages. Eye drops are irritants to the eye. They can cause chronic conditions such as dry eye, allergies, and actually systemic side effects that may upset patients. Additionally, patients have to remember to take the drops, and there's expenses to drops that need to be refilled every month. When you look at surgical procedures for glaucoma, blindness can result, and anytime you cut into the eye, there's a risk for infection that can be a very serious threat to the eye. So the advantages for a laser approach are we don't have to worry about the infections because we're not cutting the tissue. We don't have to worry about chronic chemical insults to the eye because we're not using drops. And instead, modern lasers are using the eye's own biology to reduce its own intraocular pressure. So there's something in some ways that's very natural and that works with the body to treat this disease.
Recently, a California-based company that manufactures lasers for the treatment of glaucoma and retinal diseases introduced a new laser technology that treats all stages of glaucoma. With IRIDEX's patented MicroPulse technology, glaucoma can now be treated without damaging the tissue of the eye.
Glaucoma is an eye disease where the pressure in the eye causes damage to the nerve, resulting in blindness. And we have 3 ways of treating glaucoma, all of which lower the pressure inside of the eye. That's our main target. We can use eye drops, we can use laser therapy, or we can use incisional surgeries that cut into the eye to let the fluid out. Eye drops have traditionally been the starting point for therapy for glaucoma, but with the new developments in laser technology, we are seeing laser take a more prominent place in this blinding disease.
The micropulse technology, it's almost in the name itself. The micropulse means that it takes the laser energy that you need to deliver and it breaks it into little packets. And so you deliver a little bit of energy and then you have a relaxation period, then you deliver the energy again and again. And the way that makes the laser better, it allows for the body and the tissues to recover, so you have less chance of side effects that you often see with the continuous wave laser in which there's more inflammation and damage to the site of treatment.
MicroPulse laser technology is revolutionizing the treatment of glaucoma and greatly improving outcomes of ophthalmic laser photocoagulation procedures.
MicroPulse laser is a therapy for glaucoma that is delivered outside of the eye, around the eye, and it works by delivering laser energy to a part of the eye called the ciliary body. When the ciliary body absorbs this laser energy, a biological reaction occurs that both reduces the amount of fluid the eye is producing and lets more fluid outside of the eye. These two actions together lower the pressure. Ultimately, though, what's important is that this is a laser therapy that can be delivered without any incisions in the eye. It's external, and it works with your body to reduce the intraocular pressure.
I recommend this technology, the MicroPulse technology, to patients and doctors because this is a laser that's very safe. Overall, its safety profile compares very favorably to the more traditional surgeries where you can have risks of infection, bleeding, vision loss, and those risks are much less with the MicroPulse laser. And the efficacy is about 60 to 70% of cases where it lowers the eye pressure substantially.
MicroPulse laser has now been used to treat 60,000 patients with glaucoma. It has been studied in 800 patients, and the bulk of the studies are showing intraocular pressure reduction of around the 30% range, which is substantial.
I've had glaucoma for about 18 years. I was on eye drops, and recently my eye pressure started to go up even with the eye drops, so that's when Dr. Radcliffe suggested that I have the MicroPulse laser procedure done to help bring down my eye pressure. It didn't really take that long. It was, 15 minutes, 20 minutes. After the laser procedure, I was able to go back to work the next day, and actually later on that evening, I was able to go to a show with my friend. 2 weeks after the laser procedure, I'm off my drops and my eye pressure is 7.
The MicroPulse procedure was awesome. After that, it was almost instant. I mean, the next day I'm seeing great. I felt great. There's no blurry vision. And so far when I come here to get my eyes pressure checked, it's been great.
Having had the opportunity to use this laser in my practice now over the past 4 years, I've seen fantastic results. I recommend MicroPulse laser therapy to a variety of patient types within my practice. But fundamentally, this is a treatment option for patients who are unhappy or uncomfortable on their current glaucoma medications and who are also uncomfortable with the idea of traditional glaucoma surgery, which may have higher risks.
My patients have had very good results with the MicroPulse laser. I have done many MicroPulse lasers on patients, and the patient outcomes have been really good. Intraocular pressure has been reduced, and the laser has been effective in achieving the goals that I've set out, being able to reduce the number of medications that they're on.
Many patients are appropriate for MicroPulse laser. Whereas some glaucoma treatments are limited to only mild, moderate, or severe glaucoma, this laser applies to all glaucoma spectrums, including patients who have not had surgery or have had surgery. So it's very versatile. I think it's on the table for anyone whose glaucoma is not optimally controlled who needs more aggressive treatment.
Learn more at treatmyglaucoma.com.